Welcome back to Focus on Health. In case you're joining us right now, our topic today is family planning. So, Dr. let us pick it up from where we left on the disadvantages and advantages of contraceptives.
The other advantages of contraceptive methods, especially the hormonal contraceptive methods, is that they have also been shown to reduce some conditions in women. One of the conditions, like the combined oral contraceptive pill, has been shown to reduce is things like acne, which some women have acne, and when they are using the pill, they may have better skin texture. They have also been shown to reduce the risk of benign or non-cancerous breast diseases. Of course, if you look at the ovary and the uterus, the combined contraceptive methods have been shown to reduce the risk of cancer of the ovary and cancer of the endometrium.
Actually, as women, how do we know the type of contraceptives that we would use, because we have different types of bodies?
When women come to us, we use something we call the World Health Organization medical eligibility criteria. The medical eligibility criteria is supposed to do several things. One is supposed to ensure that we remove the myths that are associated with contraceptive methods. We also use the best practices and the best science to be able to offer women contraceptive methods, and we use the best contraceptive method for that woman when we consider her characteristics and also any existing medical condition. So we use the medical eligibility criteria.
Dictionary, I read somewhere that contraceptives may have side effects such as obesity. Is that true, and how do you control it?
So obesity or weight changes is a very is of great concern to many women, and we know that some hormonal contraceptive methods are associated with weight gain. Of course, we cannot be able to determine which woman will gain weight, or because also some women will reduce weight. So this is a phenomenon that you find mostly with progesterone only methods, like the progesterone only pill, the depot, or the implants. So, but we say that, of course, women may either reduce or increase the weight, and what we allow mostly is an increase or a reduction of 3 kilograms from the baseline. If the weight increases more than that, then, and especially when the weight is increasing very rapidly, this is the time that you may advise the woman to switch over, to switch the method from the method she is using to maybe a non-hormonal method.
Dr. we have these emergency pills, the P2s, and even have teenagers using them as contraceptives. Would you advise that, or rather tell us more about the P2?
Emergency contraceptive methods is a controversial area, and it has its uses. Of course, it has its disadvantages. A woman who is using emergency contraceptive method, whether is a young woman or is an older woman, it means that there is a need probably to counsel that woman to use a regular contraceptive method because of the advantages that I'm going to talk about. The emergency contraceptive method was devised initially for emergencies, and I tell clients that, of course, an emergency, we cannot, or a woman cannot, or a couple cannot plan to have sexual activity in the evening, and then they decide that is an emergency. Of course, that is planned sexual activity. An emergency is like a couple has been using a condom and the condom has burst. That is an emergency. Or, God forbid, a woman has been sexually assaulted, okay? And that is, of course, not planned, and that is an emergency. So when we see young people using the emergency pill, then it means that there is a need now to talk about, or to them about the need to use a more regular contraceptive method, because basically they are sexually active. So what are the advantages of the emergency contraceptive method? By the way, the emergency contraceptive methods, you can either buy the post-natal, okay, or you can use the normal combined oral contraceptive pill. So you just need to take 2 and immediately and 2 after 12 hours. Or the IUD has also been used as an emergency contraceptive method. So it's not just the post-natal that can be used as an emergency contraceptive methods. When you are using the hormonal emergency contraceptive methods like the P2, is supposed to flood the ovaries with a lot of hormones to prevent ovulation. If it is taken within hours after intercourse, within 24 hours after intercourse, it is very protective, up to 95%. Of course, we say that it can work up to 72 hours after intercourse, unprotected intercourse, but the efficacy reduces. The unfortunate thing is that when the emergency contraceptive pills are taken after ovulation, there is a risk, because the main mechanism of action for the emergency contraceptive method is actually to try and prevent ovulation of the egg from the ovaries. But when already ovulation, because many women are taking the emergency contraceptive methods when they feel they are unsafe, that is when they feel that they have ovulated. But these are the women who have the highest risks of getting an ectopic pregnancy, because what happens is that the sperm will go into the uterus, to the tube, and reach the egg and fertilize that egg. In an ideal situation, the after fertilization of the egg in the tube is supposed to reach the uterus and implant within 7 days. If that egg is still in the tube 7 days after fertilization, then it will implant in the tube. And the emergency contraceptive pills, what it does is that it reduces the movement of the egg through the tube. So if it is taken after ovulation, these are the women that you find they are getting ectopic pregnancy, and that is the danger, one of the dangers of the emergency contraceptive method.
One of the side effects that we have of using contraceptives is not being able to conceive. Why does that happen, and how can we solve it?
What happens is that all methods, especially the hormonal contraceptive methods, have something we call a lag time. That means that when I stop using the contraceptive method, to the time I can conceive. For the non-hormonal contraceptive methods, they don't have any lag time. Immediately a person stops to use the contraceptive method, then they can get pregnant immediately, unless they got a problem of infertility. Maybe they got an infection, a sexually related infection, which blocked their tubes or something like that. But the hormonal contraceptive methods, we know they have a bit of lag time. The least lag time is found with the oral contraceptive methods. And we say that a woman who has stopped using the oral contraceptive method should be able to conceive within the first 3 months after stopping the oral contraceptive method. For the Depo-Provera and the implant, the lag time is usually longer. They can go up to 12 months before they are able to conceive. And this is all a matter of restarting ovulation. But for the non-hormonal contraceptive methods like the IUD and the condom, of course, there is no lag time, unless that woman, because of course, the reason why she was using the contraceptive methods, if maybe she was engaging in sexual activity with multiple sexual partners, then she got an infection, then that in itself that infection can be the cause of not getting a pregnancy.
Thank you very much, Dr. So now maybe you could go to your clarion call. What are the final remarks that you could have for viewers regarding contraceptives generally?
So contraception is good. It is good for every person who is sexually active. It has many advantages other than reducing the risk of pregnancy, because it allows women to continue with the education. It improves the women's health, because the more spacing we do between one baby to the next, then you improve the health of that woman and the health of the children and the health of the community. However, family planning or contraception and sexual activity should be achieved we say that whatever we do, of course, everything comes with advantages and disadvantages. And we must be responsible when we are using contraception and when we are having sexual activity. So the question, if we can be able to answer the question that yes, I'm sexually active, and we say, is it with the right person? Is it the right time and the right place? Because I may be having sex with the right person and the right time, but in the marketplace. Then that is irresponsible sexual activity. So if it is the right time, with the right person, at the right place, with the right protection, then we can say that that is responsible sex. And that's where family planning and contraception becomes very important.
Thank you very much, Dr. It's been a pleasure having you here and quite an informative session. There you have it from Dr. on family planning. We've come to the end of the show. I've been your host, Barry Michelle, and I will leave you with the Health You segment. Until next time, stay healthy.